Part of the team includes at least 10 doctors from the private and public sectors who will provide clinical support and respond to suicide referrals. Some 30 additional persons will be trained to conduct verbal autopsies and document findings surrounding the causes of the events. 5,000 Guyanese will also be surveyed on their thoughts on suicide and the number of suicides they had witnessed or are aware of. The Guyana Wellness Studies Suicide Prevention Project is a 5-year study which is being headed by former PAHO WHO country representative Dr. William Adukru. The study, he explained during a recent interview with Nightly News, will reassess ways of reducing suicide in Guyana.
We are looking at people who have completed the suicide. So we take samples, either the hair, saliva, or blood, and analyze that. We want to look inside people's DNA, the body constitution that makes us as human beings, to see whether there are any different markers in people's DNA that predispose them to suicide.
The findings from the study will be presented to the Ministry of Health to bolster the country's response to the societal ill. Dr. Adukru provided a breakdown of the sequential training that will occur.
If we find anybody who has a predisposition or is thinking about suicide, we need to refer the person so that it's not just a study. So we are going to train clinicians who serve as a backup for the referral. So that's going to be the first one. And then the second set of training is going to be a larger one, whereby we are training people who are going to be doing the verbal autopsies. Those who go to the homes and say, what did the person eat? What is going on in their lives? What were their challenges? All that. That would be the second training.
The study currently targets persons between the ages of 14 to 25 years old. However, Dr. Adukru highlighted that there are plans to include younger children. More funds are being sought from the United States government for that purpose.
With the second set of funds, we are going to be dropping the age lower and look at children, so from 6 to 14. Now, the idea is, if someone dies, if a child dies, we normally think of it being accident. Normally, it is accidental. But we want to see whether there are some that are genuine, because in Guyana, there are some 8-year-olds that have killed themselves.
The sum of $1 million, which will cover the first part of the study, was provided by the United States National Institute of Health. The research team also comprises international child and adolescent psychiatrists, psychologists, and social workers who will work along with local practitioners. In 2012, Guyana was considered as the suicide capital of the world, with a suicide rate of 44.2 per 100,000 people, according to a report by the World Health Organization. Since then, there has been a decline to 18.88 per 100,000, as reported by the Ministry of Health in 2018. However, the incidence and prevalence of suicide in Guyana remains relatively high, with recent events registering the deaths of teens and children. Temika Rodney reporting for the HGP Nightly News.